Urological diseases and injuries are among the most common conditions affecting children worldwide. They not only impact a child's health and quality of life, the private nature of these conditions also adds a heavy psychological burden. In the U.S., children suffering from birth defects of the reproductive or urinary tract often receive treatment while they are still in diapers, but children in low-resource areas of the world often suffer for years due to the lack of expert care. Over 2 billion people worldwide lack access to basic surgical care, and specialized care like urology is even more restricted. Meanwhile, committed doctors and nurses seek the skills they need to serve their communities.
We started working with IVUMed in 2008. They came with doctors. They also came with nurses, anesthesiologists, so the interaction was very good.
On the other side of the world, skilled doctors, nurses, and others yearn for ways to make a larger impact on the world.
My first trip over was in 2001, and I was immediately hooked. And it wasn't for the reason of just travel. It really was more the reason to teach people surgery that they had never seen.
IVUMed brought Mohammed and Fran together to build a urology program to serve not only the children of Senegal, but communities throughout West Africa.
Since IVUMed have been coming, there have been a lot of change. We moved from a setting where they were training only general surgeon who was taking care of urology to a time where we started having urologists trained. Then we have the opportunity to have IVUMed come and visit us, and we started thinking differently, taking care of the patient in a better way.
IVUMed's partners in Senegal have gone from virtually no expert training in pediatric urology to being able to treat most common conditions, serving thousands of children in need.
When it comes to working with the attendings that are in Senegal, they're already good surgeons. It's kind of exciting working with someone who already has great technique, already understands the procedures, that they have not seen the operation before. What you're helping them do is gain confidence in doing an operation that they may have only seen on an online video.
I've been working mainly with Dr. Schneck. I really learned from a very dedicated, very skilled and very professional physician, and also he's become one of my best friends. It's become more than a teaching and learning process. It became a whole family of being together in order to improve things.
Now Dakar, Senegal is an IVUMed Center of Excellence, where doctors from surrounding countries can receive the training they need to reach their communities.
I keep coming back because there's so much more to do, so you kind of find as a physician that this is why you went to medical school. Sometimes in just the business of medicine here in the States, you can lose sight of that. It's sort of rejuvenating to be able to do an IVU trip.
I continue to volunteer and enjoy being part of the organization because I feel like it makes a big difference every day, every month, every year. I think that providing healthcare, education and training and services around the world is the primary function. To organize all of that takes a lot more than just the clinical expertise. You need the business, the marketing, the finance.
This is where you come in. With your help, the work that has made such a tremendous impact in the lives of Mohammed, Fran, and the children they serve can be made available to children and adults all over the world.
Making a contribution to IVUMed is different in many respects to other philanthropic organizations out there. When you look at the per dollar impact for a contribution, there's a multiplier effect. Every dollar, every $100, every $1,000 that is contributed to IVUMed is basically multiplied by the donated goods and services by the volunteers.
Give now and help us teach one, reach many.